As we think about capturing patient data, ultimately we need to think about the best way for collecting that information. It starts with trust, and it's got to be done by the physician or the practice for a patient who's already engaged in a program, I think is the first kind of level. But then you want to establish trust with that patient so that they're actually going to give you honest feedback. The clinical issues are easier because the patient is there to get better. The other data that we're trying to get now is really around the 80% of health costs that are not directly clinically related. Most experts say that 80% of our healthcare costs are made up by those factors, not necessarily clinical factors. So these are things in our environment that cause poor health conditions. So food insecurity, housing insecurity, transportation insecurity, economic and job insecurity. Those are all factors that have been proven to say if you suffer insecurity in those areas, you're likely going to have worse health and worse health outcomes. So if we really want to get to affordability and start addressing cost, we have to address the health-related social needs. So Medicare and some commercial payers are now asking doctors to ask patients about their health-related social needs. We're asking fairly blunt questions. Are you housing insecure, food insecure, economically insecure, transportation insecure, things like that? What we want to do is peel back the layers and figure out what's actually going on with the patient. So after we establish trust, we don't just ask if you're housing insecure. We need to figure out, are you having trouble paying rent? Have you been evicted? Do you have a pest infestation problem? Are you homeless? The answers to those questions elicit different solutions, and our ability to connect the patient to a community-based organization that helps in those areas depends on the right answers in that space. So we need better specificity on the questions. We need to be able to capture that data in a standardized way to be able to track that patient progress over time and know what interventions are working. And we need to link that standardized data on health-related social needs to clinical data to determine if I identified a problem here and I deployed a solution, did it have an actual impact on the clinical outcome? And if the answer is yes, do more of that, less of the other stuff, so that we're not wasting our time in doing this effort for nothing.